I'm Greg England. I'm a cardiothoracic surgeon here at Bay Medical Center. I've been practicing here for a little bit more than 16 years. Patients certainly should sit down with their surgeon and talk about the procedure. I think it's important to try to, obviously, a complete understanding of some of this stuff. You need to go to medical school and do a residency, and so that's obviously not practical. But still, you want to have some idea of what the problem is and what the intended procedure or endeavor is going to be to try to fix it or correct it, and what alternatives there are, and then the likelihood of them being successful. Those are the things that any patient should ask about a procedure, especially something as major as heart surgery. Some patients have religious beliefs such as Jehovah's Witnesses who do not want to receive blood transfusions, so they certainly should make that known to the healthcare team, the doctors involved in their care, and ask if the hospital has a problem with that belief. And our philosophy here has been if a patient does not want a blood transfusion, as long as they understand the ramifications of that, then we won't give them a blood transfusion, even if it's a life-threatening situation. Fortunately, we can usually work around that if we have advance notice and we can prepare accordingly. Patients should ask about their experience with doing a particular procedure, not only the experience of the doctor, although that's the person that sort of gets the most focused, if you will, about it, but really the experience of the team, because cardiac surgery especially is a team endeavor. So you really want to know about the institution, which obviously is the leaders of that operation is the surgeon, but the institution and their experience with doing that kind of procedure. And then the other thing you would want to ask your surgeon about is the potential risks and complications and the likelihood of those things. Some of the complications that can happen with cardiac surgery can be pretty bad things, but fortunately they're very uncommon. But the potential risks and complications and the likelihood of them happening. There's certain complications that are common to any operative procedure, any cardiac surgical procedure, that would be a risk for any patient undergoing those procedures. But some patients would be at more or less risk for any given complication because of their particular medical history.